Percentage zoom in.
Zoom?
Yeah.
Yes.
Oh, oh, here's Dr. Basu.
Good morning, all. We'll commence in 1 minute. Okay, good morning, everyone. Before we commence, I will ask the AV team to please play the security briefing.
Welcome to the Hyatt Regency Trinidad. Your safety and well-being during this time with us is our first main priority. Therefore, it is essential and necessary that you are familiar with our emergency and evacuation procedures. Should it become necessary to evacuate the hotel, a continuous siren will sound, followed by an audible announcement to evacuate the building. When you hear, "May I have your attention please," over the public address system, you should proceed to the exit closest to you and make your way to the muster point, proceeding east along the waterfront towards the western end of the Femme du Chalet, also known as the breakfast shed. In the event of an earthquake, do not run out of the building. Stay calm, drop cover, and hold on. If evacuation is required, please listen to the instruction via the hotel's PA system for the earthquake evacuation route and muster point. Associates from Hyatt will assist you with evacuating. Once outside, conduct a head count for your group to ensure that everyone is accounted for. Should you believe someone is missing, notify the Hyatt associate in your area. Do not return to the building for any reason until the fire service has stated it is safe to do so. You are also advised that the use of cannabis, tobacco, and vaping are prohibited on the hotel's premises. Thank you, be safe, and have an enjoyable time with us.
Excellent. Esteemed members of the head table, distinguished attendees here in the room and online, good morning to you all. I am Dr. Mark Sami, Director of Corporate Services at CARPHA, and it is my pleasure to welcome you to the second Joint Regional Health Security and Regional Coordinating Mechanism for Health Security meeting hosted by the Caribbean Public Health Agency here in beautiful Trinidad and Tobago. This meeting comes at a critical time for our region as we continue to strengthen our collective capacity to prevent, detect, respond to, and recover from public health threats. Over the next 3 days, we will focus on regional coordination, early warning surveillance, emergency response, partnerships, and practical country-level action. Your presence reflects a strong collaboration that is essential to advancing health security in the Caribbean. Without further delay, I would now invite our speakers to bring remarks in the order reflected in the program. So to formally welcome us and set the tone for this important meeting, I would like to invite Dr. Lisa Indar, CARPHA's Executive Director, to deliver welcome and opening remarks. Please welcome her.
The Honorable Dr. Lakram Boodoo, Minister of Health, Republic of Trinidad and Tobago, members of the Diplomatic Corps, Ms. Helen Royer, Director of Human Development Directorate of the Human and Social Development CARICOM Secretariat, Ms. Erica Fortune, Permanent Secretary, Ministry of Health, Trinidad and Tobago, Dr. Priya Basu, Executive Head of the Pandemic Fund Secretariat, who's joining us online, Dr. Ewan Grant Green, Regional Director of the U.S. Center for Disease Control and Prevention, the Caribbean and Central America Regional Office, Ms. Dominique Afun, Senior Associate, Health, Nutrition, and Population at the Inter-American Development Bank, Dr. Mark Sami, Director of Corporate Service, CARPHA, Dr. Horace Cox, Director of Surveillance, Disease Prevention and Control, Ms. Leah Richards, Chief, Caribbean Sub-Regional Program of the PAHO WHO Office of the Caribbean Sub-Regional Program, Dr. Cyril Ugati, Director of Health Services, Emergencies, Pan-American Health Organization, Dr. Gabriel Vivas, PAHO Representative for Trinidad and Tobago, Aruba, Curacao, St. Martin, Bonaire, St. Eustatius, and Saba, Dr. Natalie Wright, Head of the UK Overseas Territories Program, UK Health Security Agency, Mr. Jobin Abraham, Director of Leadership, Governance, and Financing and Mr. Andrew Gull, Senior Technical Advisor of the Resolve to Save Lives. Rear Admiral Ayrton Sherlin, the Executive Director of the Regional Security System Headquarters. Mr. Gavin Peters, Chief Executive Officer of the Caribbean Agriculture Health and Food Safety Agency. Ms. Nadine Bushell, Acting Assistant Director of Policy, Strategy and Innovation, CARICOM Implementing Agency for Crime and Security. Ms. Alana Walters, Senior Program Officer for Preparedness and Response of the Caribbean Disaster Emergency and Management Agency, SEDEMA. Other representatives from the CDC, the Health Agency of Canada, the Organization of the Eastern Caribbean States, Georgetown University, University of the West Indies from St. Augustine, as well as the Cave Hill campus, and the FHI 360 representatives. Our chief medical officers, laboratory directors, and national epidemiologists of 21 member states, our department management team and area leads at CARPHA, other CARPHA staffs, members of the media, ladies and gentlemen, good morning.
Good morning.
It is really my distinct pleasure to welcome you all to CARPHA's second Joint Regional Health Security Regional Coordinating Mechanism for Health Security meeting, supported by the Pandemic Fund and the Center for Disease Control and Prevention. This landmark meeting marks a major milestone in the Caribbean's effort to advance regional health security through stronger coordination, integrated surveillance, and Caribbean-tailored digital early warning and response mechanisms for the region. It brings together a total of 129 participants, including 54 representatives from our 21 member states, 19 regional and international, 27 representatives from 19 regional and international partners who we just said, as well as ambassadors, CARPHA staff, and other key stakeholders. All of this reflecting a strong regional and international commitment for collectively advancing early warning and response surveillance, laboratory systems, workforce development, and multi-sectoral coordination to address current and future public health threats across our unique Caribbean small island development states, so as to strengthen preparedness and response for outbreaks, epidemics, and pandemics, and thereby advance regional as well as global health security. Your presence here sends a powerful message. It demonstrates a shared understanding that in an increasing interconnected world, health security is not simply a national responsibility. It is a regional imperative. As new and re-emerging infectious diseases continue to evolve and spread across borders, strengthening our collective capacity for coordinating multi-sectoral, real-time detection and response has never been more crucial. Ultimately, it is about protecting our economies, safeguarding our livelihoods, and ensuring the health and well-being of the Caribbean people and its visitors. Health is not a privilege. It is a human right. However, diseases knows no boundaries, and the transboundary spread of infectious diseases through the movement of people and trade, leading to outbreaks, epidemics, and pandemics, remain one of the greatest threats to regional and global health security. Now, more than ever, in our highly interconnected world, a local threat can easily become a global threat through cross-boundary spread as the movement and people and goods increases. This has been exemplified by the devastating impact of COVID-19, the resurgence of measles, and the recent two zoonotic outbreaks caused by rare strains of hantavirus and Ebola, requiring effective responses and necessitating seamless global and regional cross-boundary coordination, trust, and rapid digital information sharing, joint collective action, preparedness and fast detection, notification, and response to address effectively. Each event has tested the resilience of our health systems and reinforced the need for strategic innovation, stronger partnership, and coordinated action. Moreover, at the heart of every effective emergency response are people, you and I, trusted leaders to make timely decisions, teams that are trained and readily available, supported by systems that enables seamless collaboration across institutions and borders. When these elements are fragmented or improvised, responses are slower, they are less equitable, and more costly in lives and livelihoods. Thus, more than ever, we need to work closer, smarter, and together to protect our people and our visitors. The Caribbean's unique realities further amplifies the risk of disease spread across boundaries. Our small island developing states, highly interconnected through travel, trade, tourism, our porous borders, limited resources, and varying levels of surveillance, lab, and workforce capacity, simultaneously facing increasing vulnerabilities associated with climate change and natural disasters. These factors heighten our collective exposure to public health threats and underscores the importance of a truly integrated regional approach. Diseases respects no borders, and within the Caribbean context, an outbreak in one territory can rapidly become a regional concern. This is why a One Health, whole of government and whole of society approach is essential to the Caribbean success. Human, animal, and environmental health are intricately linked, and our preparedness efforts must reflect this interconnectedness. Functional regional capacities are greater than the sum of national capacities. By strengthening prevention, preparedness, and response together, we build a safer and more resilient Caribbean. During 2025 and the first quarter of 2026, the Caribbean experienced over 20 outbreaks in 11 countries, including dengue, chikungunya, malaria, lepto, noro, salmonella, measles, scarlet fever, influenza, hand and foot mouth diseases occurring in local and community settings, and in tourism settings, 3 noro outbreaks occurring in hotels and accommodations, and 50 cruise ship alerts occurring in the cruise ship setting. Additionally, priority diseases, including malaria and TB and lepto, were reported across the region alongside emerging and ongoing public health threats such as measles, influenza A, H5N1, and a recombinant strain of Mpox. Notably, there were single West Nile strains of West Nile virus and Oropouche cases in humans, and avian influenza identified in dead birds in 1 CMS. Antimicrobial resistance also remains a concern, with multi-resistant bacteria detected by CARPHA showing increasing prevalence. These trends are further compounded by non-communicable diseases, which lead to most deaths and disabilities in the English-speaking Caribbean, with 7 of the 10 major causes of deaths in the sub-region being attributed to NCDs. This highlights the dual burden of communicable and non-communicable health challenges in the region. With this public health landscape in mind, I stand proud today to demonstrate that CARPHA, the Caribbean's regional public health agency, designated CARICOM Health Lead, mandated by our heads of government to strengthen national system and coordinate regional response to public health threats, as well as the chair of the Regional Coordinating Mechanism for Health Security. I stand proud to demonstrate today the tangible outputs of its innovative advancement, collectively developed with our partners who are here and our member states to advance regional health security through innovative Caribbean-tailored tools and mechanisms, and which recognizes that no single country can effectively confront these challenges in isolation. In 2022, the agency developed the Regional Health Security Pathway, identifying priorities and capabilities required to strengthen the region's resilience. In 2023, we developed the Regional Health Security Pathway. First, we developed the framework, and then we developed the pathway in 2023, mapping member states' priorities, available resources, and funding opportunities, as well as gaps. Last year, we further documented the enablers, challenges, and solutions associated with implementing CARPHA surveillance systems and One Health platforms and workforce development tools, while updating country-specific priorities for regional health security. These efforts have been now translated into tangible action through the support of the Pandemic Fund, the European Union, the World Bank, the Fleming Fund, PAHO, CDC, and other valued partners. Since last year, in under 1 year, CARPHA has advanced key regional health security mechanisms, supporting member states affected by public health emergencies and outbreak, and expanded our strategic partnerships, strengthened lab and surveillance capacities, and continued the development of our novel Caribbean-tailored innovations for early warning, workforce development, and regional coordination. Among these were the CARPHA-specific, was a Caribbean-specific regional integrated early warning and response surveillance system, which you would be learning about, which will be demonstrated and you will learn about during the course of this meeting. We have moved from development to now operational phase, as well as our strengthened and realigned emergency response architecture, creating a more focused and integrated system centered on timely action, measurable readiness, and institutional coordination. Our coordinated response to Hurricane Melissa and Melissa-affected states, measles events, acute gastritis, response to arboviral diseases, respiratory illness, and other public health emergencies. Our integrated country missions, which have brought together expertise across multiple CARPHA departments, supporting member states through coordinated technical assistance and capacity building. At the same time, CARPHA has expanded its partnerships for emergency response and pandemic prevention, while pioneering innovations such as our timeliness metrics, the Caribbean adaptation to the 717 tool, designed specifically to measure and improve response within our unique small island developing states context. Since our last convening, CARPHA has continued to refine its direction and sharpen its trajectory. We have been advancing in a more focused and deliberate pathway towards emergency and response. This trajectory is underpinned by strong emphasis on timeliness, measurable results-based outputs, and tangible impacts for CARPHA and our member states, which is what regional health security demands. We are moving with a purpose, from strategy to action, from outputs to outcomes, which what truly matters. At the heart of this work is a simple but powerful principle. The Caribbean requires Caribbean-tailored solutions. Our region interconnectedness means that no member state is fully protected unless we are all protected. This is why we continue to invest in a regional architecture built around shared early warning systems and Caribbean-adapted mechanisms to strengthen health security. None of this progress would have been possible with our strong partnerships and our collaboration we have built across the regional and global health community. Through engagements such as the World Health Assembly, the World Health Summit, and other major meetings, CARPHA has been able to showcase its platforms as well as to gain momentum for its implementation. Our experience continues to demonstrate that the best way to protect individual member states is through collective action, strengthened surveillance and early warning systems, and a broad network of trusted partnerships. The regional coordinating mechanism itself, which will be the focus of Day 3, was established by the CARICOM heads of government in 2014 in response to the chikungunya outbreak, to chikungunya epidemic and the looming threat of Ebola. Since then, it has evolved into a vital platform for coordinating planning, information sharing, strategic dialogue, and collective action to address the Caribbean public health priority. Today, we face an increasing complex global landscape characterized by emergent pathogens, evolving disease patterns, and shifting geopolitical realities. It is timely and necessary that we convened the second joint RHS RCM-HS meeting to accelerate our progress. Over the next 3 days, we will work together to demonstrate the ministerial-approved operational CARPHA Caribbean-specific real-time integrated early warning systems innovations for improving pandemic preparedness and response to the Caribbean, to determine the tools used for surveillance and emergency response by our member states and chart the way forward for country-specific implementation, to update the regional and global advancement and challenges, including reassessing public health threats and priorities of member states and agencies, to advance regional coordination, collaboration, surveillance response, training, and data sharing, to update on our regional coordinating mechanism, to strengthen our partnerships for a coordinated approach to pandemic preparedness and regional health security. It is my belief and our belief that the Caribbean's greatest strength lies first in our solidarity. The challenge before us is significant, but it is not insurmountable when we work together. Our shared knowledge and our leverage of our collective expertise will result in success. As we begin this meeting, I encourage each of us to approach these discussions with openness, innovation, a spirit of collaboration, and trust. Let us use these next 3 days to not only review progress, but to shape the future of regional health security in the Caribbean. The decisions we make, the partnerships we strengthen, and the systems we build together will determine how effectively we protect our populations for the threats of tomorrow. Together, we can ensure that the Caribbean remains resilient, that the Caribbean remains prepared and united in safeguarding the health of our people. Thank you all, and I wish you a successful meeting.
Thank you, Dr. Indar, for those remarks and for your continued leadership and for stressing the importance of an integrated regional approach to regional health security. I would now like to invite Ms. Helen Royer, Director of Human Development at the CARICOM Secretariat, to bring remarks on behalf of CARICOM. Please welcome her.
Thank you very much. The Honorable Dr. Lakram Bodo, Minister of Health of the Republic of Trinidad and Tobago, Dr. Lisa Inda, Executive Director, Caribbean Public Health Agency, Dr. Priya Basu, Executive Head, the Pandemic Fund Secretariat. I think she's joining us virtually. Dr. Yoran Grant Green, Regional Director, U.S. Center for Disease Control and Prevention, Caribbean and Central America Regional Office. Ms. Dominique Afun, Senior Associate, Health, Nutrition and Population at the Inter-American Development Bank. Ms. Leah Marie Richards, Chief, Caribbean Subregional Program, PAHO, WHO Office of the Caribbean Subregional Program. Ms. Erica Fortune, Permanent Secretary of the Ministry of Health, Trinidad and Tobago. Chief Medical Officers, Lab Directors, National Epidemiologists of 20 CARPHA member states, representatives of regional and international partner agencies, other distinguished delegates, members of the media, ladies and gentlemen, good morning. It is a pleasure to join you in Trinidad and Tobago for these important regional health security and regional coordination mechanism meetings. On behalf of the CARICOM Secretariat, I extend warm greetings and acknowledge your continued commitment to strengthening public health systems across our region. I also commend CARPHA for its leadership in advancing regional surveillance, preparedness, and response. Today, our health systems face increasingly complex and interconnected challenges that no single country can address alone. Recent years have shown us that health emergencies affect more than health. They impact economies, education, tourism, trade, and national security. The Caribbean continues to face multiple pressures. Globally, concerns such as Ebola outbreaks, emerging infectious diseases, and health impacts of climate change highlight the importance of preparedness and resilience. Discussions at the 79th World Health Assembly also reinforced the need for stronger pandemic preparedness, equitable access to vaccines and medical countermeasures, and sustainable financing for health security. At the same time, geopolitical uncertainty can affect access to essential medicines and timely response to emergencies, particularly for small island developing states. These realities reinforce an important truth. Health security is not solely a national issue. It requires coordination, timely information sharing, and sustained regional cooperation. CARICOM has long recognized this. Through efforts at strengthened surveillance networks, enhanced laboratory collaboration, regional coordination mechanisms, and CARPHA's leadership in implementing a regional health security framework, the Caribbean has improved its capacity to prevent, detect, and respond to public health threats that cross borders. We are aware that CARPHA continues to play a critical role in supporting member states through surveillance, laboratory services, workforce development, outbreak preparedness, and emergency response. Its work in advancing regional digital early warning and response systems is particularly important as we seek to faster detect, better information sharing, and stronger evidence-based decision-making. Partnerships are equally essential. We value the continued collaboration of agencies and institutions represented here today, including the UK Health Security Agency, the Inter-American Development Bank, PAHO, SIDIMA, and other regional and international partners working alongside Caribbean governments and institutions to strengthen resilience. Looking ahead, we must continue building health systems that can respond effectively to emergencies while maintaining essential services. This requires sustained investment in preparedness, workforce capacity, laboratory strengthening, coordination mechanisms, and sustainable financing. Above all, health security must remain people-centered. And that is because behind every surveillance system, laboratory result, and coordination mechanisms are Caribbean communities whose well-being depends on our ability to act effectively and collectively. I am encouraged by the significant, and I say significant efforts being undertaken by CARPHA and our member states to strengthen preparedness and build resilience across our region. I trust these meetings will produce practical outcomes, stronger coordination, and clear priorities for advancing regional health security. On behalf of the CARICOM Secretariat, I reaffirm our commitment to continued collaboration with member states, CARPHA, and our regional and international partners in building a safer, healthier, and more resilient Caribbean community. I wish you productive and successful deliberations. Thank you.
Thank you, Director, for those remarks from the CARICOM Secretariat. We are pleased to now have Dr. Priya Basu, the Executive Head of the Pandemic Fund. Thank you for bringing remarks, Dr. Basu. She'll be joining us virtually. Over to you.
Thank you so much. Can you hear me?
Yes, we can.
Great. Honorable Minister of Health, Trinidad and Tobago, Dr. Lisa Indar, Executive Director, CARPHA, Dr. Helen Royer, distinguished colleagues and partners, good morning. Thank you, Dr. Indar, for the invitation to join this important gathering. And thank you to the Caribbean Public Health Agency for its leadership in advancing regional health security across the Caribbean. I regret that I'm not able to join you in person today, but I'm honored and pleased to be with you virtually. As we meet this week to advance regional coordination, strengthen partnerships, and accelerate preparedness efforts, the world continues to be reminded of the importance of these investments. The Ebola outbreak in Central and Eastern Africa is a stark reminder of what is at stake when preparedness gaps remain and why sustained investment in preparedness matters. Moments like this underscore the importance of strengthening the core capacities that enable countries and regions to prevent, detect, and respond to health threats before they escalate into larger crises. These capacities include diagnostics, laboratory systems, surveillance, and the health workforce, with community engagement serving as a critical foundation across all of them. And these are the core priorities of the Pandemic Fund. Just a few days ago, the Pandemic Fund's governing board approved an emergency financing package of up to US $220.6 million to support affected and at-risk countries responding to the Ebola outbreak. This rapid action reflects the fund's commitment to providing fast and flexible support when countries face urgent health threats. Importantly, this financing is also helping to leave behind stronger systems capable of preventing, detecting, and responding to future health threats, both within and across borders. The same principles apply here in the Caribbean. Effective regional health security depends on countries, institutions, and partners working together to strengthen preparedness across borders. CARPHA has long demonstrated the value of this approach through its leadership, technical expertise, and commitment to regional coordination. The Pandemic Fund is proud to support the Caribbean region and proud to be partnering with CARPHA. We currently have 6 projects in the Caribbean, 3 country-level projects in Guyana, Suriname, and Trinidad and Tobago, 1 multi-country project focused on the Eastern Caribbean, and 2 regional entity projects, one led by CARPHA and the other led by the Inter-American Institute for Cooperation on Agriculture, IICA. Together, these investments have helped mobilize over $590 million for pandemic prevention, preparedness, and response in the Caribbean region. Pandemic Fund grants totaling $108 million have catalyzed $357 million in co-financing from international partners and $124 million in co-investments from the recipient countries and regional entities themselves. We're strongly encouraged by the progress achieved through the CARPHA project under Dr. Indar's leadership and with the support of partners, including IDB as an implementing entity. The project has demonstrated tangible results. With support from the Pandemic Fund grant, the region has launched its first digital One Health platform and a new mass gathering surveillance system, which was successfully deployed during major events, including the 2024 ICC Men's T20 Cricket World Cup. More than 1,500 stakeholders were trained on the system and deployed for national events across 9 member countries. Upgrades to the tourism health information system and the Caribbean vessel surveillance system generated more than 4,000 health reports and enabled rapid outbreak responses, with 92% occurring within 24 hours. 2 new specimen referral and transport systems were established. These achievements are not simply technical milestones. They represent stronger regional capabilities to identify threats earlier, share information faster, and respond more effectively. We're also pleased to see the continued progress and innovation around the novel Regional Integrated Early Warning and Response System, or the RIEWSS. This initiative reflects the kind of regional public good that strengthens collective resilience. Through connecting data, systems, and people, it helps enable earlier identification of public health threats and faster action. The integration of vector-borne diseases and their surveillance into this broader framework marks an important step towards a more coordinated and data-driven approach to preparedness and response. The Caribbean is demonstrating that preparedness is strongest when countries work together, invest together, and learn from one another. The lessons emerging from CARPHA's work have relevance far beyond this region and can help inform preparedness efforts around the world. Today's second joint regional meeting on health security will provide a critical platform to reinforce regional partnerships, enhance coordination among member states and agencies, and strengthen operational mechanisms that underpin regional health security. The Pandemic Fund remains committed to supporting CARPHA and the Caribbean region as you continue to strengthen health security and build lasting resilience against future threats. I wish you all a very successful meeting this week. Thank you.
Thank you, Dr. Basu, for your remarks and for the Pandemic Fund's valuable support to the Caribbean region. Thank you very much. I would like to now invite Ms. Dominique Afun, Senior Associate, Health, Nutrition, and Population Division of the Inter-American Development Bank, to bring remarks as the implementing entity. Over to you, Dominique. Please give her a hand as she comes to the podium.
Good morning, everyone. All protocols observed. On behalf of the Inter-American Development Bank, it's a pleasure to join you today for the opening of the second Joint Regional Health Security and Regional Coordinating Mechanism for Health Security meeting with the Caribbean Public Health Agency. I'd like to begin by congratulating Dr. Inda and her team for convening this important gathering of key public health leaders and stakeholders from across the region. And I'm particularly pleased that this important initiative is being supported by the Pandemic Fund Technical Corporation, reducing the public health impacts of pandemics in the Caribbean through prevention, preparedness, and response. Through this partnership, the IDB is proud to serve as the implementing entity, supporting CARPHA in reducing public health impacts of pandemics across the Caribbean and helping countries strengthen their capacity to prevent, prepare for, detect, and respond to future public health emergencies. This initiative reflects a shared commitment by CARPHA and its member states to ensure that the lessons learned from recent global health crises translate into stronger and more resilient health systems for the future. Today's meeting comes at a critical moment as emerging health threats continue to test the resilience, preparedness, and coordination of health systems across our region. Whether it's emerging infectious disease, antimicrobial resistance, foodborne illnesses, zoonotic outbreaks, or future pandemics, the Caribbean operates in an environment where health threats can move quickly across borders and where no country, regardless of size or resources, can address these challenges alone. So this conference therefore serves as a critical purpose strengthening collaboration and coordination among Caribbean countries and partners to advance regional health security and pandemic preparedness. At its core, this gathering is about building a safer, stronger, and more resilient Caribbean. Today, I'd like to speak less about health security, infectious disease, and technical outputs, and more about something that addresses these: innovation and regional collaboration. Because when we reflect on CARPHA's impact in the region, what stands out is not only the technical achievements, but its unique ability to bring people together around a common purpose. For decades, the Caribbean has demonstrated something fundamental. Our greatest challenges do not stop at national borders, and therefore our strongest solutions can't stop there either. Whether it's responding to outbreaks, strengthening surveillance, or supporting laboratory networks, even coordinated emergency response effort, the lesson is consistent. The Caribbean is stronger when we act together. So the history between the IDB and CARPHA reflects the same belief. It's been more than 2 decades, dating back to the days of CAREC, that the IDB and CARPHA have worked side by side to improve public health across the Caribbean. Throughout that time, our partnerships have been built on shared understanding that many of the region's most pressing health challenges require collective action, shared resources, and regional leadership. This is also reflected in the IDB Group's strategic direction for the region. Through our One Caribbean framework, we are promoting a model of development that recognizes that many of the Caribbean's most important challenges and opportunities transcend national borders and require regional solutions. Health security is one of the clearest examples of these principles in action. As Dr. Inda said earlier, climate-related health threats, antimicrobial resistance, and infectious disease, they don't stop at borders, and neither should our data, our solutions, nor our partnerships. So today's gathering is also aligned with the IDB's institutional strategy and our commitment to strengthening resilience, building institutional capacity, advancing digital transformation, and fostering greater regional integration. For us, supporting CARPHA is about much more than supporting individual projects. It's about investing in one of the Caribbean's most important regional institutions and advancing a model of collaboration that strengthens the entire region. What has always distinguished CARPHA is its willingness to innovate, which is recognized globally. In 2023, they became one of the first regional entities in the world to successfully secure financing from the Pandemic Fund. Through the technical cooperation, it's strengthening surveillance systems, laboratory networks, workforce development, and regional coordination for health security. This achievement reflects not only the technical excellence, but also the confidence that the international community places in CARPHA as a trusted regional institution capable of delivering meaningful impact and results. So this is a significant milestone for the Caribbean. It shows that regional solutions can be ambitious, innovative, and globally competitive. More importantly, it validates something that we in the Caribbean have long understood. When we work together, regional capacity becomes greater than the sum of its individual parts. A few months earlier, the IDB hosted an event. Both the Minister and Dr. Inda were there, and the former West Indies Vice Captain, Mr. Derek Murray, was there, and his words could not be more relevant right now. He said, "We may be separate nations, but we are one formidable force when we bat in the same crease." And that's exactly what the regional health security is about as well, working together. We've seen this action through the digital mass gathering surveillance system that was deployed during the Men's T20 Cricket World Cup, and it provided real-time monitoring and rapid response capabilities across multiple countries and venues. It was a powerful example of how Caribbean innovation can strengthen preparedness while operating quietly behind the scenes. In fact, the FIFA World Cup is coming up, so some of the host countries could probably benefit from a few Caribbean lessons from CARPHA on how to monitor major sporting events and keeping millions of visitors safe. To Dr. Inda, Dr. Sami, and the wider CARPHA team, member states, and all the partners gathered here today, thank you for your leadership, your commitment, and your vision. The IDB is so proud to stand alongside you as a long-standing partner, and we look forward to continuing this journey together. Thank you.
Thank you, Mr. Foon, for your remarks on behalf of the IDB, and thank you, of course, to the IDB for your continued partnership and support. I now invite Ms. Leah Marie Richards, the Chief of PAHO's Caribbean Sub-Regional Program Office to bring remarks. Please welcome her.
Thank you, and all protocols observed. I will not attempt to list and recognize everyone. I think Lisa did a remarkable job. But what I do want to say is that PAHO is very, very pleased to have received this invitation to give remarks. And on behalf of the Sub-Regional Program for the Caribbean, I am genuinely glad to be here. Not just as a representative of this PAHO program that oversees the sub-region, but as someone who has spent much of her career working alongside the people and institutions in this room, and who understands from that experience just how much this kind of gathering matters. Health security can sometimes feel like an abstract concept, a framework, a set of indicators, a column in a work plan. But we all know what it actually means. It means the virologist who sequences a novel pathogen and gets the result to a decision maker in time to contain it. It means the epidemiologist who detects an aberration in syndromic surveillance data before a cluster becomes an outbreak. It means the public health laboratory that can identify a drug-resistant strain of TB before it crosses a border. And it means the Minister of Health who can stand before his or her citizens during an outbreak and say, we detected it early, we are getting support from our regional partners, and we did not face this alone. This is what we are building here. PAHO's role in the region has always been to walk alongside, providing technical guidance and normative support. Our joint sub-regional cooperation strategy with CARICOM 2025 to 2029 is the framework that structures that commitment, and health security is one of its core pillars. And everything we will discuss over the next 3 days reflects that shared strategic direction. What gives me particular pride in the depth and breadth of the PAHO-CARPHA collaboration that underpins so much of the progress we will review this week is that our technical cooperation spans the full spectrum of health security, from governance, policy and planning, to syndromic and laboratory surveillance, to risk communication and community engagement. We have worked hand in hand with CARPHA, and we will continue to work to strengthen AMR laboratory surveillance, pharmacovigilance, on wastewater and environmental surveillance, on workforce capacity development through specific training programs, and on building climate-resilient health systems, among many other topics. We have also collaborated on NCD prevention, as well as the regulatory architecture that underpins safe access to medicines and vaccines across the sub-region. We will continue to strengthen this collaboration and have already identified key areas for continued engagement, formalized in our subsidiary agreement and collaboration framework. We gathered this week with real momentum behind us. Much of this work has been done by you in collaboration with partners that are here and under the leadership of CARPHA. The task now is to translate that momentum into the concrete, coordinated action that our member states deserve. Systems that detect threats early, share data seamlessly, and respond as one region. PAHO is fully committed to that work and to every partner in this room who make it possible. I look forward to the conversations ahead, and again, I thank you for the invitation.
Thank you, Ms. Richards, for the continued collaboration with CARPHA. I now invite Dr. Joran Grant-Green the Regional Director of CDC's Caribbean and Central America Regional Office, to bring remarks. Please welcome her.
Buenos dias, bonjour, good morning, all protocols observed. It is my distinct privilege and honor to greet you on behalf of the U.S. Centers for Disease Control and Prevention this morning. I bring specific greetings from our Division of Global Health Protection, our Center for Emerging Zoonoses and Infectious Diseases, our Office of Readiness and Response, and our Center for Influenza and Respiratory Diseases, who are all proud to count Caribbean member states and, of course, CARPHA as partners in regional health security. A special note of thanks to the government of Trinidad and Tobago for hosting all of us. Hopefully this will be a warm-up for future mass gatherings, maybe before Ash Wednesday, not sure. Stay tuned. For the U.S., regional health security is national security. We've heard a lot from our prior speakers about borders, security, cross-border infectious agents being transmitted, and all the things that we need to do to control them. So I'm going to spare you a recap of those details. But we see convening for a meeting like this as a critical component of this strategy that has to span even more than one region, right? 48 hours after the recent hantavirus outbreak on a cruise liner impacted a few of our citizens, we were able to reference the Caribbean's cruise vessel surveillance system as an example of the work that can be done to improve readiness and preparedness for this type of an outbreak. Similarly, 72 hours after the activation of the most recent Ebola outbreak affecting Central and East Africa, the Tourism Health Information System was highlighted as a potential detection mechanism for monitoring travel health in these evolving times. These are concrete examples of CARPHA's innovation, resourcefulness, and impact, but most importantly, of their partnership. The partnership with the member states represented here, the partnership with international and external donor organizations, and all the critical components that are required to protect the health not just of Caribbean citizens, but their esteemed neighbors, who also like to visit on the 2 days before Ash Wednesday. So this demonstration of partnership is really what brings us all here today, and we're honored to count ourselves as a part of this partnership network. Partnerships exist between you all as sovereign member states, across the CARICOM agencies represented here, and of course with other external agencies like myself or nations that have shared interests and objectives. For CDC specifically, we are really interested in prioritizing early warning systems, systems that are integrated, that are seamless, that facilitate alerts that allow us to contain emerging threats before they evolve into pandemics. And we're excited to see the progress that has been made to that end here. We are fascinated by the community of practice that is emerging around some of the innovative strategies. We see that CARPHA is participating in wastewater and environmental surveillance. We're pleased to be a part of that consortium. We also see CARPHA reaching across regional borders through the MOU that I believe was signed last year with the Council of Ministers of Health in Central America, or COMISCA. So as we count ourselves as a part of this global community, this regional team that is invested in the health security of the Caribbean and its surrounding areas, we want to acknowledge that we can't do this work alone, and we're so grateful that we're all in this fight together. With CARPHA, we are looking forward to expanding the availability and accessibility of digital health information that can be used to mobilize early responses to emerging threats. And we see gatherings as this as tools that truly strengthen the network of preparedness and response that makes us all safer, stronger, and more resilient. So with those brief remarks, I want to thank you on behalf of the agency and the U.S. government for the opportunity to participate in this meeting and work alongside each of you, our esteemed colleagues and neighbors, and we look forward to a productive next 3 days. Thank you.
Thank you, Dr. Grant Green, for CDC's support to this meeting, not just physically, but financially as well. It is now my honor to invite the Honorable Dr. Lakram Bodo, Minister of Health of Trinidad and Tobago, to deliver the keynote address. Please give him a warm Caribbean welcome.
Thank you very much, Mark, for your introduction. Good morning, everyone. Good morning. All right, so the good news according to the program is that I've already spoken, and everything I have to say has already been said. But nevertheless, I'm very happy to be here this morning to join you all in what I see as a very important program. I don't believe I have the privilege of saying that all protocol observed. So I want to, of course, recognize Ms. Helen Royer, Director, Directorate of Human and Social Development, CARICOM Secretariat, Dr. Lisa Endar, Executive Director of CARPHA, the members of the Diplomatic Corps, who are here with us at the table. I'm very happy to have you join us this morning. Ms. Erica Fortune, Acting Permanent Secretary at the Ministry of Health, Dr. Priya Basu, Executive Head, the Pandemic Fund, who joined us online, Dr. Yoran Grant Green from the CDC, Dr. Ciro Garrity, Director, Health Emergencies, PAHO, Mrs. Leah Marie Richards, Chief Caribbean Sub-Regional Program, PAHO. Very happy to have you here at the head table. Our good friend at the Ministry of Health, Dr. Gabriel Vivas Francesconi, PAHO WHO Rep for Trinidad and Tobago, Ms. Dominique Afoun from the IDB, Dr. Horace Cox, who is here with us as Director, Surveillance Disease, Prevention and Control, Ms. Leah Marie Richards, Chief Caribbean Sub-Regional Program, PAHO WHO Office of the Caribbean Sub-Regional Program. I don't want to leave anybody out, but we still have quite a few on this. I'm almost at the point where I'm going to say all of the protocols observed, but, but of course the team from CARPHA, the other members of the CARPHA staff, members of the media, ladies and gentlemen. Very good morning. I just want to say the first thing I observed, I live in San Fernando, which is south, so I left early. I arrived here at 8:45 this morning for a meeting that was supposed to start at 9. And I was very impressed because I saw so many representatives here in this room who were already in the hotel space. And therefore, you know, I believe that we have a disciplined group of professionals here this morning who were very much on time at 9 o'clock to start this program. Normally, Director Indar, when I'm invited to other functions, sometimes we have to wait and, you know, for the room to fill, but the room was very filled this morning. At this meeting, I believe that we have 21 CARPHA member states, we have 54 country representatives, 27 reps from 19 regional and integrated partner agencies, 48 staff members from CARPHA, 129 participants in all. And on behalf of the Ministry of Health and the government of the Republic of Trinidad and Tobago, I want to say a very special welcome to you, to Trinidad and Tobago, and I trust that your next 3 days here will be productive and fruitful, but also for those of you who are from abroad, will take the time to enjoy our beautiful country as well. So I say a very special welcome to you. Allow me at the outset to commend CARPHA for its continued leadership in advancing the regional health security agenda and for convening this most important gathering of experts, policymakers, and partners from across the Caribbean and beyond. I also wish to acknowledge the invaluable support of our regional and international partners, including PAHO, the CDC, UK HSA, the Inter-American Development Bank, the Pandemic Fund, and CARICOM, all of whom continue to play a critical role in strengthening the health security architecture of our region. Leah Marie Richards, I wish I could be that Minister of Health who could say at some point in time, because it will come at some point in time, that we detected it early, and I believe that is why we are here this morning. So And of course, I cannot and I will not be able to say that unless we have the kind of cooperation going forward. So ladies and gentlemen, the conversations taking place here today are about far more than laboratories, surveillance systems, emergency operations, centers, or technical frameworks. At their core, they are about people. I believe that we may have the safest mass gatherings before Ash Wednesday, Dr. Green. And of course, that mass gathering is world famous, and I believe it has a special significance for Dr. Green, but I will not reveal that here this morning. You can speak to her about it privately afterwards during the meeting. You have 3 days to discuss it. But of course, she was speaking about Carnival, a very important and significant event that can throw many challenges to, a Ministry of Health, a Minister of Health, and indeed a government. So it's about people, it's about protecting families, it's about preserving livelihoods, it's about safeguarding our economies and ensuring that future generations inherit a Caribbean that is resilient, prepared, and secure. The COVID-19 pandemic fundamentally changed how the world thinks about health security. For decades, health security was often viewed as a specialized concern of public health professionals. As a doctor myself for the last 40 years, I would be intimately aware of this. But now we understand that health security is national security, it's economic security, and it's human security. A virus emerging thousands of miles away can quickly disrupt global supply chains, close schools, overwhelm health systems, cripple tourism-dependent economies, and alter the course of entire societies. I believe, ladies and gentlemen, we've seen that happen to the world post-COVID and during COVID. And of course, the Caribbean understands this reality perhaps better than most. We are a region of interconnected island states. Our economies depend heavily on travel, trade, and tourism. Our people move freely across borders. We face increasing climate-related threats, emerging infectious diseases, foodborne and vector-borne illnesses, and the growing challenges associated with antimicrobial resistance. In such an environment, no nation can stand alone. So the health security of one Caribbean nation is intrinsically linked to the health security of all Caribbean nations. Indeed, one of the most important lessons emerging from recent years is that preparedness and response cannot be achieved in isolation. The Global Health Security Index, which assesses preparedness across 195 countries, reached a sobering conclusion. No country in the world is fully prepared for future epidemic and pandemic threats. This is a very sobering thought indeed. So no country, not the wealthiest, not the most technologically advanced, not the most scientifically sophisticated, the lesson is very clear. Preparedness is not a destination that we arrive at. It is a continuous process of investment, vigilance, collaboration, and adaptation. So COVID-19 taught us something else as well. It taught us that technical capacity is not enough. Countries with sophisticated laboratories, advanced health systems, and significant financial resources still struggled. Why? Because health security depends not only on infrastructure and technology, but also on leadership, trust, transparency, public confidence, partnership, and coordination. The most advanced surveillance system in the world cannot succeed if information is not shared in a rapid manner. And I have to commend CARPHA in this regard for sharing information in such a rapid manner. And I'm speaking, of course, of the Ebola threat, and that information is being shared quickly and updated, and we are grateful for that as a government. The most sophisticated laboratory cannot protect populations if findings are not translated into timely action. And the most comprehensive emergency response plan cannot succeed without the trust and cooperation of the people it is designed to protect. So trust remains one of the most important assets in public health. Trust between governments and citizens, trust between institutions, trust between countries, trust between science and society. Ladies and gentlemen, one of the central themes of this meeting is the strengthening of regional health security through prevention, preparedness, and response. I believe the future of health security lies increasingly in our ability to prevent and detect threats before they become emergencies. Historically, we have often measured success by how effectively we respond to crises. Today, we must also measure success by how effectively we prevent them. This requires investment in surveillance systems that identify unusual patterns early. It requires modern laboratory networks capable of rapidly detecting emerging pathogens. It requires a trained and resilient workforce. It also requires stronger data systems and information sharing mechanisms, and increasingly it underscores the need for embracing a One Health approach. We now recognize that human health, animal health, and environmental health are deeply connected, something that the previous speakers alluded to this morning. Many emerging infectious diseases originate at the interface between humans, animals, and ecosystems. As climate change, environmental pressures, and global mobility continue to reshape health risks, our ability to work across sectors will become increasingly important. I want to take a moment to commend CARPHA's leadership and continued commitment to the development of regional integrated early warning surveillance system, an innovative suite of digital integrated surveillance tools and mechanisms, laboratory and workforce development for transforming emergency preparedness and response in the Caribbean. These mechanisms, specially tailored to suit our Caribbean health system, capacities, and infrastructure, and endorsed at Ministers of Health level at the recent meetings of the Council for Human and Social Development in September 2025 and recently in April 2026. I therefore recommend its use for the region. Only weeks ago, CARPHA facilitated specialized training here in Trinidad and Tobago in the safe transport of infectious substances and diagnostic specimens, bringing together professionals from the agriculture and animal health sectors. So, ladies and gentlemen, preparedness also requires sustained investment. One of the greatest risks we face is the tendency to invest heavily during crises and then allow those gains to erode once the immediate threat has passed. We cannot afford to repeat the cycle. The systems we build today must be maintained tomorrow. The partnerships we strengthen today must endure tomorrow. The capacities we develop today must remain operational tomorrow. This is why initiatives such as the Pandemic Fund are so important. They help move us beyond short-term emergency response and toward long-term resilience. They help strengthen surveillance systems, laboratory networks, workforce capacity, and regional coordination. Most importantly, they help create sustainable foundations upon which future generations can build. Here in Trinidad and Tobago, we remain committed to supporting these efforts. We recognize that investments in digital health systems, public health surveillance, healthcare preparedness, and workforce developments are investments in resilience. They're investments in safer communities. Ladies and gentlemen, as we look ahead, we must remember that the next health emergency may not look like the last. Future threats may emerge from novel pathogens, and we've already described the conditions and the sequences that can cause this. So as I close, ladies and gentlemen, I want to say that the next pandemic will not ask whether we are ready. The next pandemic will simply arrive. Our responsibility is to ensure that when it does, the Caribbean stands prepared, not as separate nations responding independently, but as one region united by a common commitment to protecting the health and well-being of our people. The Ministry of Health and the Government of the Republic of Trinidad and Tobago stand in full support of this initiative here, and I want to say that I look forward to your very productive and successful deliberations over the next 3 days. May God continue to bless our region and its people. I thank you so much. Thank you.
Many thanks, Honorable Minister, for your keynote address. The Minister mentioned rapid information sharing, timely action, and of course, trust and cooperation. So thank you again, Minister, for your support and your guidance to the agency. All right, so we've come to a very important part of the agenda, which is the official photos. So we're going to ask everyone to please remain before the coffee break. And while the guys move the table, I will announce the order. So we'll have one photo with the head table. Then we're going to ask everyone to please come at the front for an entire group photo. And the third photo will be one with the head table and the diplomatic corps. The fourth photo with the head table and the partners here, or the regional partners, or the international partners. And the last photo, the fifth one, with the head table and the CMOs. So thank you very much. We'll ask the guys to move the tables for the first photo. So head table, everyone, diplomatic corps, partners, CMOs. Thank you very much.